Most of the people with eating disorders admitted to the Hollywood Clinic were people who were experiencing anorexia nervosa. There were some people with bulimia nervosa and some people with avoidant restrictive food intake disorder, but all were admitted with malnutrition of varying degrees. And so in order to nutritionally rehabilitate people, we needed to feed them and get them to a safer weight. Or for those with bulimia nervosa, we weren't necessarily trying to restore weight, we were just trying to support them to eat regularly and adequately. So refeeding is really the process of nutritional restoration to a minimum safe place for treatment to continue in the outpatient or the day program setting. Prior to me doing the research, there was some concern that adults who required refeeding might not be as safe as adolescents during the refeeding because of a higher risk of having something called refeeding syndrome. So we really were looking at whether our adults in our program were able to be similarly refed as the adolescents. The main findings were numbers-wise, we had the vast majority were those with anorexia nervosa. So our solid conclusions were able to be made around those groups of adolescents and adults. So both could be refed at the same rate. There was no incidence of refeeding syndrome or complications in the adolescent group. There was one person in the adult group who developed edema, which is one of the side effects, and we had to slow the feeding down a little bit for that person, but the edema resolved over time. The overall result in terms of weight restoration was that they could be refed at the same rate, and their weight restoration was the same. There was no difference between the rate of weight restoration. In terms of the psychological change as well, we measured psychological change, which hasn't been measured very much in inpatients, and particularly adults, prior to this research. And we found also that there was in looking at all of the adolescents and all of the adults in the program, they all achieved significant psychological change in a positive direction. The results and the conclusions show that there's, or will reassure people that you can actually feed most adults with anorexia safely in this hospital setting, and you can expedite in some way their feeding so that they don't have to remain in hospital. Or Hollywood itself to say this is, they could produce annual data, for example, on what the outcomes of their program are. It would just give people much more confidence coming into the hospital. This is the outcomes of our program. If they were to be able to keep the program structure similar to that, that would just give people, it would be part of the, information people have when they come into hospital. What is the effectiveness of this program, rather than kind of coming in a little bit blind and not really knowing. I think the psychological side of things is quite reassuring, because there has been quite some concern that, particularly from psychologists, that if you're putting somebody under that level of distress, or feeding, and that's creating in some way some increased distress, which it apparently does when you're working with these people, it's sort of reassuring that actually there is some positive change in hospital, and there's evidence for that, rather than sort of anecdotal. Just some added confidence that feeding in this way is good and it's okay, and it can actually mean that the person's in hospital for less time. I think I've been with people with eating disorders almost entirely for the last maybe 14 years or so, and I think that their illness is like nothing else. People with an eating disorder have to suffer, they suffer so much, and I think that anything that's going to, give us some indicators about how to do things better with this group of people is great. And I think when you get to the point in the treatment of patients where they're actually coming back and thanking you very much for the really hard work which they're doing, but you're also supporting them in, and they're, often they're not very thankful because you're asking them to do something that they don't want to do. it just became so much more, satisfying, and felt like we're doing some good work here, and we really need to let other people know how we're doing this good work so that they can, if they wish, follow it. But also for Hollywood and Ramsay in the bigger picture itself, so to give them some baseline data so that they can then audit from that data if they so wish.